George Scriban, talk to us a little bit about HealthVault at Microsoft and what it can do for consumers. I imagine that still many people are just not aware of HealthVault and all that it potentially could do.
I think what we're all seeing is that the benefits of electronic health records kind of depend on where they're deployed. Within a provider setting, the benefits are a very different set than when we're talking about the deployment of something like the capability of collecting, aggregating your health information personally. And that's where HealthVault plays. It's interesting when you think about the way I like to characterize it is that I have a healthcare identity. It just happens to be fragmented among all of the various providers I've ever seen in my life, whether they are small practitioners without a medical health record or without an EMR to large-scale providers who happen to have one. Every plan that's ever covered me, every PBM, pharmacy benefit manager that's been behind me, every pharmacy that's fulfilled at retail level, every lab company that's taken a look at me. And if I'm managing a chronic condition myself at home, there's probably a range of devices that know a little bit about me. And that's all splintered and fragmented. What HealthVault does, or a service like HealthVault, is it essentially allows a consumer to collect, store, aggregate this information, and then make use of tools on top of it. Things like health risk assessments, condition management tools, basically personal health management tools that help them manage their health, whether they're chronically well or chronically ill or, like most of us, kind of someplace in between. And we found that when people are actually have the data that is in front of them, they tend to, it's very difficult to manage what you can't measure. And before you have a service like HealthVault in place, or if you are a member in an integrated delivery system like Group Health, when you have that data in front of you and you can see the trends of your numbers, whether you're diabetic or you're hypertensive, you manage to that metric. It's just like me driving my Prius. I manage to the miles per gallon, particularly recently. And it's that level, very simple level of engagement and reinforcement that, from a personal level can really help. It's also another benefit is that, we've all talked about not existing before you were 78, or the benefits of being part of an integrated delivery system like Group Health. What we really want with HealthVault is to be able to deliver ththose benefits to everybody. So you don't have to be part of one system or another, whether you're with Kaiser or Group Health or you're a beneficiary in a PPO. Mm-hmm. You get all of these sources of information aggregated in one place so that you can provide to the caregiver the right information at the point that care is being given. That ultimately is the vision for something like HealthVault. And really, who's got more at stake and who's more interested in better outcomes and the delivery of the right care than the individual patient?